I'm Dr. Anthony Geroulis. I'm a facial plastic and cosmetic surgeon. I practice in Northfield, Illinois, and in downtown Chicago at the Neiman Marcus building. I've been asked, what is my consultation like, the experience that a patient has? Well, they walk through the door and they're greeted warmly. I want them to have a very comfortable atmosphere because this is one of the most important decisions you're going to make in your life. This is your face, and it has to be highly respected. Right after that, you should be seen relatively soon, depending upon your time schedule and your appointed time. You shouldn't be waiting 45 minutes or an hour to see a doctor, not for an elective surgery like this. This is a consultation. They should have adequate time for you, and I make sure that happens. Right after that, I meet with the patient myself. I don't have any other handlers. I meet with you, and I talk to you about your concerns, and I then examine you thoroughly in a chair that goes up and down so I can really test your face, see your animation, and make my notes on what you need, in my opinion, to get a natural result, to get a more youthful result, but not look operated on. After that, I'll explain to you each of the procedures I may propose. I will explain them to you in detail, and I will answer all of your questions. I will also suggest that you write things down, because you're welcome to come back at a later time, because you'll think of other questions, believe me, and you'll want them answered. So I'm happy to sit down with you at some other time with an appointment, and that's all complimentary, the second appointment, and answer all your questions. After I've explained everything to you, my goal is to make sure you haven't felt rushed. I want this to be your time. I don't put a time limit on it. It's not 30 minutes or an hour. Actually, oftentimes it goes well over an hour. But that's the consultation that I want to give, because you're my priority. And when you're my patient, you're my top priority. And that's why I even give every patient post-operatively my cell phone number, because I want them to answer I want them to know they can find me at any time. So if they have a question after surgery, I'm there. There's no answering services and there's no other malarkey. You get me right away, and that's what you should have. You want to find a doctor who has you as his top priority. I want to make sure you've had all your questions answered, and you will have a lovely result. I want you to look as good as you feel, and I want you to look natural. What I could tell you is that with the internet, you have great advantages. I would tell you to look at the credentials of the doctor. In my case, my credentials are pretty obvious. I've been a facial plastic surgeon for over 30 years. I'm also a full professor, clinical professor of surgery at the University of Chicago. That means that they've already vetted me. They've examined me from top to bottom. But even all of that aside, you can check other things. Check their website. Examine that. Look at their reviews. The ultimate test, however, is going to be to come in and have a consultation. That's going to give you an opportunity to evaluate that doctor. And you should be interviewing that doctor. You have to come out and decide, do you and he or she click? Do you trust them? Find out what the doctor wants. Like in my case, I often want pictures of the patient prior. Why? Because I want you to have a very natural look. I don't want you to look operated on. I don't want you to have that pull tight look. You're going to look like you, but just years before, a younger you. I want you to look as good as you feel. I want you to feel more youthful. You've got all the spark. We just need to bring up the shine. I'm often asked the big question, why should I have cosmetic surgery? Well, actually, this question you've answered by coming in for a consultation. Actually, you've answered it already by looking at this video. You already know inherently that something isn't right because you don't look the way you feel. The whole goal is to feel good, and we do that through our diets and through our exercise and how we've been living better and better. The next thing you want to accomplish is you want to look now as good as you feel. How many people go and exercise and get their bodies in great shape? And I mean really good shape. But then they look in the mirror and they see this face that doesn't match the rest of their body. This is a serious concern. And there's a lot of psychological evaluations and data and papers written by prominent doctors that explain that if you look in the mirror and you're not happy, you're not going to be a happy person and things won't go as well. They just won't. You need to be positive and you need to look in that mirror and see what you like to see. So that's our goal, to have you be happier. So then the next question is, are you a candidate? Well, there the doctor should evaluate you from a medical perspective. Remember, this is an elective operative procedure. It doesn't have to be done. So you have to make sure, or that doctor should make sure, that you're in good health so that there won't be any problems. Remember, your safety is paramount. It has to be absolutely top of the list. You have to come in healthy, you have to go out healthier, but you're looking younger, looking fresher, and looking natural. Those are the things the doctor should follow, and those are the things that you should evaluate in yourself to make your decision as you then go to the next step. And it's a big step to find the doctor who should have the privilege to touch your face. I hope that if you make that decision, that you have a chance to meet with me. Thanks a lot.